Hi, everybody. So, we're continuing with day 2 of our natural hormone support, and we're going to continue talking about a few other hormonal glands and areas where we might experience some concern. So, now we're getting into the men and the women. And I'm going to start talking about men. As most of us know, that men, their main area of hormone glands are the testicles, and their job is to do a few things. One is to produce sperm. Now, you probably remember this from health class. I find this interesting that our Creator would make us so that men, throughout their reproductive life, they can make brand new sperm, whereas us women, we are born with all of the eggs that we are ever going to have, millions of them. Fortunately, we don't use all of them, but men are able to produce sperm throughout their life. Now, they can experience fertility issues, though, if the sperm isn't maybe viable, if the sperm count or concentration is low. So it's really important for men to have a proper balance of their testosterone. That's the main sex hormone that we think about. It helps develop all of the male reproductive tissues and things like that. But also, it provides secondary benefits so that a man grows in muscle mass. Our teenage sons and things like that, even when they get done with high school, they're still growing and developing. They're still growing in bone mass and muscle mass, and certainly hair. Okay, so testosterone has wide benefits for men, but men also men have estrogen. And it's the problems that we see with men's hormones is a lot of times that as these hormone disrupting compounds that we're getting ready to talk about, as they begin to disrupt the man, he's not getting all the raw materials that he needs to make testosterone, then they tend to lose muscle mass. Men, as they age, then tend to get more body fat. And one of the problems with obesity and having excess fat is it gives off an estrogen like compound. So, as a man, if their testosterone is a bit low and they start to gain weight and this estrogen like hormone starts to rise, it will further suppress testosterone. So, we really want to see a good balance with men. So some signs of of an imbalance is a low sex drive. That is with both men and women when our hormones get out of balance. And when I was in private practice, I would oftentimes have patients ask me, maybe not about fertility issues, but they would tell me that as a consequence of their low back pain, that they might be having some issues. And then they'd start to talk about fertility issues and things like that. So with men, maybe sex drive is one issue, but also the amount of sperm production. Maybe they're not able to make that as well. They start to have problems with erectile dysfunction. Maybe they have difficulty maintaining an erection. Some other issues, though, in that same area of the body is as a man's testosterone and estrogen levels are getting out of balance, it affects the health of their prostate gland. Also in that area, and the prostate gland helps store and keep the sperm viable until they are released. And so if a man starts to have some imbalance in their prostate, they can start to have some urination problems at night. They can develop a condition called benign prostatic hypertrophy, which is a fancy way for saying some of their plumbing's not working and they're having trouble starting and stopping a stream of urine. So lots of things that can go on with them. Of course, I've already mentioned that a man, as their hormones get out of balance, as they get low testosterone, that they gain weight, they lose muscle mass, and they can lose hair. So hair loss isn't just a genetic predisposition. It can also be seen with this low testosterone. Particularly we see as men age, one of the things we'll see is that they get less body hair out on their extremities, into their arms, their legs, and things like that. So those can be some signs of low testosterone. Okay. So what we're going to do is we're going to go ahead and start another video here in just a little bit, talking about the women and some of the common imbalances that they have. So in the comment section, we've got a lot of women that are attending this class and a few men. In the comment section, you don't have to say, oh, I'm having a problem with this, or oh, my husband's having a problem with this. Maybe just tell me in the comments, was there a symptom that kind of surprised you as we mentioned and we went through them? Maybe something new that you had learned as far as how hormone imbalances can affect men. Okay, and I'll see you back here in a little while to talk about the women.